which is marked on the 14th of November every year. The day is a response to growing concerns about escalating health threats posed by diabetes. And the World Diabetes Day is considered as an opportunity to raise awareness and campaign about diabetes, risk factors, and healthy lifestyle and advocacy for diabetes management. Every year, World Diabetes Day campaign focuses on a dedicated theme that runs for 1 or more years. As this year, the World Diabetes Day coincides with the International Year of the Nurse and Midwife. The theme for the World Diabetes Day 2020 is the nurses and diabetes. And it acknowledges that nurses make the difference for diabetes. And that's the theme of our webinar today. This webinar is jointly organized by International Diabetes Federation, Mena region, International Council of Nurses, and WHO Regional Office for Eastern Mediterranean. And we hope to bring different stakeholders to highlight the increasing concerns with the escalating diabetes prevalence and how diabetes care can be improved by strengthening the role of nurses in diabetes care. So I'm here together with very distinguished panelists who will bring different perspectives and different experiences. So we will start hearing the perspectives from the co-organizers of this webinar or the celebration of the World Diabetes Day in 2020. And this will be followed hearing voices from the field, from our colleagues who are working in the field and dealing with diabetes managed care and management day to day. And then we will hear perspective of patients living with diabetes. How do they see the health systems and what is their experience? What is their experience with the involvement of nurses? And we have the policymakers' perspective that will follow the interventions. And in the last part of our webinar, we will look into the way forward, how we will take the opportunity of this day to move forward and to take this agenda forward. Without further ado, I would like to start the webinar and invite our panelists. But before that, I would like to point out that we have questions and answers box in the bottom of your screen. So we would appreciate if you put your questions into that box, and we will respond either during the webinar in writing, or we will have some section in the webinar where we can answer your questions as part of the webinar orally as well. So please put your questions to the questions and answer box as we go along with the webinar. So first, I would like to invite Dr. Asmus Hamerik, the Director of the Universal Health Coverage Non-Communicable Diseases Departments at WHO EMRO, for his opening remarks. Asmus, floor is yours. Thank you.
Thank you so much, Gülin. Distinguished participants, colleagues, and friends, good morning from Cairo, and thank you so much for being with us, at least online today, as we do during COVID times. And thanks in particular, of course, to the co-organizers from the International Diabetes Federation, Mena chapter, from the International Council of Nursing, and of course within the House. It's a great pleasure to be with you today. This year, the World Diabetes Day, as was said, coincides with the International Year of the Nurse and the Midwife, and therefore today's event focuses on highlighting the role of nurses in the prevention and management of diabetes. Diabetes is recognized as an important cause of premature death and disability, also in the 22 countries of the Eastern Mediterranean region, as well as globally, where the prevalence has been readily rising for more than 30 years now. Diabetes is, of course, also a huge risk factor for heart disease and stroke, and it is the leading cause of blindness, low limb amputation, and kidney failure. It's also that diabetes and its complication are a great economic challenge for advancing universal health coverage, and people living with diabetes are more likely to experience catastrophic personal health experience. Many obstacles still exist for the optimal organization of healthcare systems, good availability and accessibility of medicines, a well-trained health workforce, and enough information for decision-making to ensure that people's needs are fully met. Whilst the COVID-19 pandemic has exposed the vulnerability of our health systems in terms of disease preparedness and response, for example, by bringing the challenge of providing care for people living with diabetes to the forefront, nurses are making a difference. As the largest group of health professionals worldwide, constituting almost 60% of all health professionals, nurses are often the first point of patient contact, close to their communities, and ideally placed to help prevent, detect, and manage diabetes and its complications. So the theme of this year's World Diabetes Day, Nurses Make the Difference for Diabetes, highlights the critical role of nurses in supporting people living with a disease. The focus of this webinar, jointly organized, as we said, with IDF, ICN, and other colleagues, convening a wide range of partners, and I'm really delighted to see so many participants, already more than 100 in the box now, is hence to highlight the escalating diabetes prevalence in our region and to address the question of how diabetes prevention and care can be further improved by strengthening the role of nurses. So specifically, the objectives of this webinar are to highlight the nurse's role, to discuss gaps and challenges impeding that role, to emphasize the collaborative efforts, and we have a great opportunity today with so many people being interested, and to discuss a way forward to maximize the nurses' contribution as part of multidisciplinary teams in providing essential health services, particularly for diabetes, but also for other non-communicable diseases. So I hope that our collaboration and exchange on the day today in this webinar will provide our existing efforts with a new impetus to jointly strengthen the role of nurses and improving the health and well-being of people living with diabetes in our region and beyond. I thank you very much and wish all of us a very good day. Thank you.
Thank you very much, Asmus. Thanks a lot for inspiring start. And now I would like to invite Professor Jamal Balcadesh, who is the chair of International Diabetes Federation, Mena region. And Professor Jamal Balcadesh is also a specialist, internal medicine specialist, and he's specialized in endocrinology and diabetes, bringing a long experience in this area. Professor Jamal, the floor is yours.
Thank you very much. Good morning, afternoon, evening, dear friends and colleagues. Thank you for giving me the opportunity to speak. It's a real pleasure to be with all for this webinar. First of all, I would like to thank the organizer of this webinar, including experts in different domains and from different countries. The theme of World Diabetes Day 2020 is the nurse and diabetes. The campaign aims to raise awareness around the crucial role that nurses play in supporting people living with diabetes. Diabetes is chronic disease affecting millions of people around the world, and it's recognized as an important cause of premature death and disability globally in the Eastern Mediterranean region. Many countries in the region are struggling to meet the healthcare needs of people with chronic disease, and people living with diabetes are more likely to experience catastrophic health expenditures. As you know, COVID-19 pandemic has imposed challenges to the provision of care for patients with diabetes and taught us how vulnerable our systems are in terms of preparedness, and nurses have a crucial role to play in supporting people affected by diabetes, and the role of nurses is becoming more important as part of the multidisciplinary health team in managing the impact of the condition. The larger, stronger, and better trained nurses, the more significant their contribution would be in the prevention, early diagnosis, treatment, and management of diabetes. For diabetes communities, the year to come will also offer a window of opportunity, as 2021 will be the 100th year anniversary of the discovery of insulin. A century after, insulin and diabetes care are still affordable for many, especially for poorer households. To improve the health and well-being to diabetic people and save their lives in our region, IDF Mena, with International Council of Nurses and WHO MRO, are committed to take this agenda forward jointly to increase awareness on the competencies and functions of nurses in preventing, controlling, and managing diabetes, and to improve capacities of nurses in managing diabetes. Thank you for your attention.
Thank you, Jamal. And now we would like to hear the perspectives from our third partner in this webinar, co-organizer of this webinar, International Council of Nursing. David Stewart is representing ICN in this panel. He is the Associate Director for Nursing and Health Policy. And David is bringing a long experience in the leadership positions in the government sector prior to his position. So we are really looking forward to hear your perspectives, David. The floor is yours.
Great, and thank you very much, and welcome to all who have attended today. It is great to be able to participate in this event. I'm based in Brisbane, but we're meeting with the world, and it is fantastic. It would be quite remiss of me not to remember what is going on and to acknowledge the work of nurses across the world as they struggle with the pandemic. We know, for example, that there have been more lives lost with nurses than the world wars. We also acknowledge the sacrifice, the innovation, the abilities, the courage, and the scientific reasoning that each nurse is displaying at this point of time. So it is important just to acknowledge that, and we're looking at diabetes care. If we just go to that next slide. It is important to know that at the beginning of this year, and you've heard already that there are approximately 28 million nurses making up the majority of this health workforce. But what is just as interesting is to know that there is a massive shortfall of around 6 million nurses. And the struggle that we are going through now will potentially only exacerbate this very problem. We know that mental health issues, resilience is at an all-time low, and we know that there's many who are planning to leave the profession. Why does this matter? It matters because nurses are the primary providers of care throughout the world. And if we can harness that ability appropriately, we can really be a powerful force for change, and we can really make a difference in the lives of those with diabetes. Just go to that next slide, please. We know that at the moment there are great challenges, and we're desperately trying to fix the pandemic and the current emergent issues. But as a result of this, at the same time, what we are seeing is that many non-communicable disease services have either been dramatically cut, reprioritized, and put into different areas. Many screening services and primary healthcare services, public nurses, community nurses, those are currently being put on hold and redeployed into other areas. So whilst we have this footprint of the pandemic, there will be this greater escalation into the future of interrupted chronic disease conditions that we will need to work through, particularly as we start to struggle with some of the workforce issues. Next slide, thank you. So some of the key features and why nursing is just so important to this whole conversation is nurses' primary role is to be a carer and advocate for the patient, and they spend the majority of time out of all healthcare providers with the patient. And we know that health literacy, particularly amongst those with diabetes, there's only about anywhere between 14 and 40% good health literacy with patients with diabetes. Action to address that issue will improve self-management, improve self-care, improve promotion, prevention, and other things. Care coordination has been mentioned earlier on. One of the core features of nursing is bringing together and trying to coordinate care, because diabetes is not alone. As you know, it's relationship with either cancer or cardiovascular disease, stroke, or many of the other diseases that requires a coordinated approach. It also requires nurses to be working to their optimal or full scope of practice. There is much that can be done if nurses are given the opportunity to do what they have been educated, trained, and have the abilities to do. We've also mentioned the access through telemedicine, and that will be brought up a lot later. But a number of the screening services, whether they be through opportunistic screening, such as clinics run within shopping centres or within the community, have been disrupted this year. And how do we pick up that early detection will be critical moving forward. But no one profession can do this alone. And it is about this bringing together the community, whether it be psychologists, dietitians, nutritionists, doctors, or nurses. It is a multidisciplinary approach, including the care of the patient. Next one, thanks. Next slide. Some of the key features of what policymakers don't understand about nursing is there's often a lack of understanding about what can nurses do, what can they actually help with, and can we trust them to do this? Can we let them do screening? Do they need the permission to this? There's often a fair bit of lack of understanding about what the key roles and responsibilities of nurses are. In addition, there's often inadequate or inappropriate funding models. Funding models have often been set up for short consultations that don't address key issues such as lifestyle modifications. And systems aren't always geared to continuing that development of education for nurses. Just go to that next slide, thanks. We might go to the next one as well. So as part of the EDSIC strategy of moving forward with nursing, some key things need to happen to enable nurses to provide optimal care for patients in terms of promotion, prevention, and care of people with diabetes. We need to maximize the contribution of nurses, whether it be rapid expansion of nurse-led clinics, nurse-led models of care and education, or bringing on more advanced practice nurses that can operate to their full authority, working in collaboration with other healthcare teams. And we see this approach is starting to take off in many countries as countries are trying to establish how do we achieve UHC. Also, the barriers have been put up to stop or that hinder nursing practice, hinder innovation, can sometimes dictate or make key issues out of this. So what do we need to do? I think we need to raise the profile of nursing, raise the leadership of nursing to take on a greater role within diabetes care. I want to end with an example that's done in Tonga. So I'll quickly go through this. So if you go to this next slide, the Pacific region is one of the highest levels of diabetes in the world. 25% of people living in these regions are diabetic. Now, the key issue there is that over 30,000 amputations per year result from diabetes. 30 years ago, this wasn't the case at all, and the only form of amputation was due to leprosy. You know, that equates to nearly one amputation every 20 minutes. The case example I want to bring to you is from Tonga, and this is from a small country where there are 3 amputations per day. That affects the livelihoods not of the individuals, but also families and also the entire community. They implemented a strategic role of bringing in advanced practice nurses to address non-communicable diseases, particularly diabetes. What we have seen as a result of that initiative over 5 years, a very simple program out in the community, is a major reduction in the number of amputations per day. It is now around 0.6. Now that is a huge change with actually quite a limited amount of investment to those lives within the community. And it's something to consider is just the power of what simple, effective initiatives can do with education. So I just wanted to end with that story. And I'd just like to say thank you. It is a great honor to be able to participate in this event today.
Thank you very much, David. I think you laid out the issues related to nursing very well, and I think you'll end with a concrete example from Tonga, what nurses can do in diabetes care, how they can make the change and difference is a very powerful example, and actually it paves our discussion to the next part of our webinar very well, because we would like to hear more examples of this kind. And we have our colleagues from the field, from Lebanon, Oman, and Bahrain, who are actively working in diabetes care on the day-to-day basis. And we would like to hear their first-hand experience, their first-hand thoughts about this issue. So first, I would like to invite Ms. Anna Parsekian from Lebanon. And she's a registered nurse and she's diabetes specialist nurse. And currently she's working as the diabetes management coordinator at Mount Lebanon Hospital. And in her current position, she contributes to patient education in their diabetes management, increasing the knowledge, as well as conducting audits in the Mount Lebanon Hospital for ensuring proper diabetes management by the nurses. So, Anna, we would really appreciate if we can learn from your experience and involvement in patient education and empowerment on diabetes management, and especially in insulin therapy as a nurse. Floor is yours. Thank you.
Thank you. Good morning, everybody. I would like to share with you my own experience, as you said, about my diabetic patient education. Me, as a diabetes nurse specialist, my role is to instruct, to support, to educate, and empower, as we said, the diabetic patients and their families too, especially for the diabetes medication management, so that they can have self-management of their diabetes treatment. My role is to educate the patient about their medication if they were in the hospital and leaving the hospital after hospitalization, or if they are in the diabetes center as an outpatient, especially when they are starting a new medication. Patient must be educated about what type of medications they are taking, what are the role, what are the side effects of the medication, and especially the insulin. I educate them about the type of the insulin they are taking, if it's a rapid, basal, so that they can know exactly at what time they can take. The importance is to prevent any overlapping of the medication or the overlapping of the insulin, and exactly to take before meals, and especially to rotate the sites of the insulin injections, so that we prevent any lipodystrophy or any complications. I follow up with the patients daily or 2 to 3 times per week for their SMBGs, so that we can share with each other and to help them to titrate the doses of the insulin. And also I educate them about how they can self-manage, how they can know how to titrate the insulin doses every 2 to 3 days, depending on their blood glucose levels. They should know that when they can contact us whenever there is any hypoglycemia and whenever there is hyperglycemia, especially so that we can manage the medication. Also supporting their families so that they can also, if we are talking about type 1 diabetes, the children, how they can learn how to use any devices for insulin pumps and for insulin injection. Patients, as we said, I follow up them by phone. They can contact me by emails, they can contact by WhatsApp, and especially nowadays, due to the pandemic of the COVID-19, we are shifted to more telemedicine, teleeducation, as we said. The patients I contacted the patients all the time by phone, by sending their SMBGs for me by WhatsApp and by emails. It was very hard because one-to-one sessions with the patients, education, group session for the, I used to do group sessions for the patients, for diabetic patients, especially if I gather 2 to 3, 4 patients taking the same kind of insulin, so that they can share experience with each other. They can share some things that some of the patients doesn't know. But due to the COVID-19, that was unavailable, so it was more by phone. It was challenging, but we tried as much as we can so that we can regulate their blood glucose. We can titrate exactly the doses of the medication and the insulin to prevent any hyperglycemia. And they were also having so much panic about regulating their glucose levels so that they can they are not prone to any infection, or if they had any in COVID-19, so that they can regulate their glucose levels. Thank you.
Thank you very much, Anna. I think you have laid out some of the functions that roles that nurses can play in diabetes, following up and managing patients with diabetes. And also you highlighted the use of telemedicine, especially during COVID, which is also leading us to our next presentation very nicely. So I would like to invite Mrs. Zubayda Al-Harti from Oman. Zubayda is senior staff nurse in the National Diabetes and Endocrine Center in Oman. And currently she's actively involved in the self-management education of diabetic groups and trains other nurses on this issue, managing diabetic patients. And Zubayda, we know that you have extensive experience in using telemedicine for management of diabetes, especially during COVID-19 pandemic. Could you please tell us how you see the role of nurses in utilizing telemedicine for management of diabetes? What are the challenges and benefits in using telemedicine? Floor is yours. Thank you.
Hello, everyone. Good morning and afternoon. I'm Zubaida Al-Harthi, working in National Diabetic and Endocrine Center. So I'll just give you a little brief about National Diabetic Center. It's a tertiary care institution in Oman. It was opened in 2013. So we receive high-risk patients from different regions in Oman. So we have like 3 main diabetic clinics, and they are being seen by multidisciplinary team. Diabetic educator is a member of multidisciplinary team, and we are all located in one building. Diabetic education clinic, it's a nursing-led clinic. Even we got the opportunity to create our own visit for documentation. Diabetic educators are crucial multidisciplinary in providing good patient care and promoting self-care management. They work in diabetic care and in variety of care settings. So part of our role is like providing training to other staff nurses from different regions, health center, polyclinic, tertiary hospital. Our other role as well is public awareness in walkathon, public event, Hajj Ramadan. So we use so many methods in managing diabetic to improve their quality of care. One of the models that we are using is telemedicine. So what is telemedicine? It's a new model of diabetic management system. It refers to the practice of caring for patient remotely when the provider and patient are not physically present with each other. It helps in improving the quality of care for patients. Right. So why did we start telemedicine? In the first year of establishing NDEC, educators were following up patient SMBG by fax and email. Why did we start? As I mentioned before, we are located in Muscat and we see patients from all different areas. So it was very difficult for them to attend the clinic. So here it came the idea of using fax and email. Then we wanted to improve the system. So in 2016, we started with WhatsApp. For close-up follow-up. Then here this year with COVID-19, during the pandemic crisis, it was not that hard in using this system because we already started previously. So we had only to categorize patients into 2 groups. So who require to attend the clinic and who just need telemedicine appointment. How do we choose them? It's according to the seriousness of the case of the patient. Diabetic management can be very challenging in the best of time. Adding in stress and disruptive routine that come with the crisis, self-care can be even more frightening, especially with patients that are having diabetes, because that puts them into high risk for infection. So during pandemic crisis, COVID-19, it led to the patient miss their appointment. At the same time, we had to reduce the number for patients to attend the clinic. So diabetic educator for us to stay connected with our patient. So telemedicine was there. It can help bridge the gap for patient when visiting the health worker. It's difficult. And also it helps us in also provide flexibility in scheduling the patient, especially like critical times. Sometimes we had the patient during their appointment, they are positive and they need close monitoring. So it was very easy for us through telemedicine to stay connected with patients and regulate their blood glucose during their crisis. And as well, we have GDM patient that who needs continuous care, continuous follow-up. We couldn't ask them to attend the clinic, so we just follow them by telemedicine. Especially when we have patient newly diagnosed, they really need support. So support system was always available through telemedicine. And when I'll come and say, talk about advantage of telemedicine, it has its own advantage, follow up wide range of patients who live far away from NDEC, as I mentioned before. It increased compliance to SMBG. Patient shows improvement in blood glucose profile and HbA1c due to frequent sending their SMBG. It helps us to solve patients' acute emergency immediately, especially for those who stay very far away from us. Finally, it is cost effective due to patient reduce the need to attend to national diabetes, especially those who live outside Muscat region, reduce admission and prevent complication. Unfortunately, nothing is too perfect. We had our disadvantage of using telemedicine. It became a little bit overwhelming for diabetic educators due to high number of messages received. So we can't leave the center unless we answer all of their questions. Some of our patients, they misuse of telemedicine by sending greetings, good morning, good afternoon, have a nice weekend. Some question that is not related to diabetes. We had some issue with they're sending not reliable SMPG. And as this one, time consuming for educator, because verification, it has some issue with that. That's what I wanted to say about telemedicine. Thank you very much.
Thank you very much, Zubayda. I think it is quite inspiring, and I can see that you have been able to maintain the essential services for patients with diabetes throughout the pandemic, which is very much a concern in many countries to how to maintain the essential health services during the pandemic, and there has been some interruptions. I believe your previous efforts paid off and helped you to continue with the services to the people. We have so far heard from the role and experiences of nurses at the hospital level and at a specialized diabetes center. But we always emphasize the role of nurses in management of non-communicable diseases and diabetes at the primary care level. So we are so pleased that we have Ms. Lamiz Al-Mugawi from Oman. She's a nursing supervisor at a local primary healthcare center in the Kingdom of Bahrain. And Lamiz is also a member of a number of societies, including the Bahrain Diabetes Society. And we know, Lamiz, you have a long experience working at the primary care level in diabetes management, especially, and as well as some research in this area demonstrating the role of nurses at the primary care in managing diabetes, managing complications. Looking forward to hearing your experience. Floor is yours.
Thank you so much. Well, good morning and good afternoon, everyone, according to your country time. And it's my pleasure to participate in this effective webinar. Well, I'll talk about the Bahrain, what's the practicing in Kingdom of Bahrain. First of all, according to the National Non-Communicable Disease Risk Factor Survey, the prevalence of diabetes increased. So in this case, the Kingdom of Bahrain, mainly Ministry of Health, work hard to focus on this disease. I'll talk mainly about the primary care, because the primary care is the first step for the patient to seek the medical advice. And also, the primary care has a significant role in community and also to reduce the burden on secondary care. Well, I will start about the brief history about the diabetes clinic and health center. In 1997, primary care established 3 diabetes clinic and health center. By 2006, they generalized the diabetes clinic among all the health centers. Currently, we have 25 diabetes clinic. In 2018, a protocol established to give the comprehensive care for the diabetic patient, to generalize, first of all, to generalize the care among all the diabetes clinics in the health centers, and also to generalize the transition of the patient, of the diabetic patient through the different sector of healthcare and Ministry of Health. And also for sure to protect Bahraini society from further complication. So I'll talk now about the diabetes clinic and the health center. But before that, I will just give the thanks, and I really appreciate the nurses services and the primary care for educating the nurses through the workshops, seminars, conferences. They were really educated to deal with the patient in the diabetic clinic. And the role of the nurses in the diabetic clinic are very important. Actually, we have two types of rules: a role of nurses in diabetic clinic and also role of nurses in the treatment room. The role of nurses in the diabetes clinic, it will start from the assessment and collecting data like history and lifestyle, vital signs, and for sure the blood sugar level, and also assessing the food of the diabetic patient. I would just like to mention that we have 3 categories for assessment of the diabetic food. Annually for low risk, every 6 months for moderate, and every 3 months for the high risk, and also when the patients need it. And also the diabetic nurse will do the further referral for the patient, like the retina clinic, and it will be annual, the dental hygienist, especially in the first visit and when needed, and also treatment room and the social worker. And for sure, the follow-up, coordinate with the community nurse, and health education. Health education, I will focus about the health education because it's a really important role for the diabetic nurse. Health education, first of all, about the insulin and the site, the rotation of the insulin site injection, and also about the monitoring the blood sugar level, self-managing in hypoglycemia, using the glucometer, adopting healthy lifestyle and healthy food, usage of medication regularly, and the exercise, and also about the daily food care. About the nurses in treatment room, the role of the nurses in treatment room, for sure she will follow up the order from the diabetic clinic and also from the doctor. And also doing further tests such as ECG, intraocular pressure, vision test. And also we will provide in the treatment room the scheduled vaccine for the diabetic clinic, as well as the other non-communicable diseases. And also we'll do the needed dressing for the patients. And I want to mention that also the home supply. In primary care, we are providing home supply for the diabetic patients, such as glucometer, insulin injections also from the pharmacy. For that, we are providing strips and lancet as well. And also the continuous of the health education, especially again about the daily food care. I would like to mention also that as we know, in the COVID-19 pandemic, the visits of the patients to the health center, it will be minimized, but that doesn't stop the role of the nurses in dealing and taking care of the patient. We are still providing the same care, and also we are providing other services such as telehealth, the consultations and appointment. It will be through the telephone. Also the follow-up with the lab result, and also delivering the medication and home supply to the patient to their homes. And also providing health education about social distance, especially in this situation, and advice to follow the COVID-19 exposure prevention instruction. And again, also, we will encourage the patient to contact the diabetic clinic when needed. Okay, now I'll talk many times about the food care. Food care is really important among the diabetic patient because all of us knows that one of the main complications in the diabetes among the diabetic clinic is food ulcer, especially if they are not taking well care about the food or practicing poor knowledge. So myself in 2012, I conducted a study in Bahrain. First of all, I reviewed different studies from different researchers globally. So I found that there is a poor in practicing the food care and also the knowledge about the practicing the food care. Hence, I planned to put a study and to study the situation in Bahrain, especially that there is no previous study done about this case in Bahrain. So I examined the knowledge of the diabetic patient about daily food self-care. And according to the finding, I will provide further recommendation. And that's what I did. So I used the descriptive quantitative design with 80 convenience sample of diabetic patient from the diabetic clinic, and I adopted instrument from previous studies. Well, the finding shows that majority of the patients have poor knowledge about daily self-food care and also poor practice. Hence, we decided to give health education and educational session, workshop in the community itself, in the society, and for public, in simple words for the patients, just to know more about the proper practice for the daily self-food care. By that, I'll just finish my talks. Thank you so much. Hopefully, I just speak in 5 minutes.
Thank you very much. Thank you. I mean, combining your practical experience and research brought some light into the issues. I think I would like to remind that we have this question and answers box. If you have any questions to our panelists, please type your questions there and we are going to respond them. And now we have heard about the importance of addressing the needs of diabetes patients, how nurses can contribute that. And all of our objective is to provide the best services to people living with diabetes, to improve their health and well-being and quality of life. So when we reach there, I think it is very important to hear the views of people living with diabetes. And to bring that perspective, we have Dr. Sana Ajmal from Pakistan. Sana is executive director of an NGO called Mati Zindagi. Sana has type 2 diabetes, and she has already worked with International Diabetes Federation. She had very prestigious positions there, and now she's the executive founder and executive director of the Mati Zindagi NGO, which is really an organization to create awareness and educate people about diabetes and empower people living with diabetes. So, Sana, as a young Pakistani lady living with diabetes, you must be in a regular contact with the health system and healthcare providers in your country. Could you please describe us briefly your journey and your experience in the healthcare system? What are the positive and negative aspects of the care and support you receive? And what are the recommendations that you can make to improve? Thank you for being with us, and floor is yours.
Thank you so much, Dr. Guleen, and thank you, WHO, IDF, and ICN for inviting me to participate in this very important discussion with this esteemed panel. My presence here today shows the commitment of these highly esteemed organizations to the diabetes community, and listening to their voices and listening to their concerns and actually embedding them into whatever we are going to do in the future. As community leaders, we cannot stress more on the important role of nurses in diabetes care, who are actually our first line of contact in both inpatient and outpatient diabetes care. The medical sector in Pakistan has a tilt towards doctors, and though our patients to doctor ratio is 1 doctor for approximately 1,300 patients, which is a 23% deficit from the WHO recommended numbers, the nurse to patient ratios are deficit by almost 48%. That's a huge number, a huge deficit. It's not only about the numbers, but also about the effectiveness of the role that they are designated to play in the healthcare teams. I am a noisy diabetes advocate, so I'm really sorry if I feel like showing the other side of the picture, but this is the ground reality in many countries, especially ours. Most outpatient endocrine or diabetes specialist nurses or diabetes specialist clinics do not have a diabetes nurse or an educator to provide the primary care needed by the diabetes community. The very positive aspect of having trained diabetes nurses is that they take care of a lot of questions that the doctors don't have time to answer, or we don't get a chance to ask in the doctor's office. The diabetes nurses are more available and helpful. They actually educate and empower people with diabetes. But just like we need to empower nurses, we also need to empower people with diabetes as people who can take good care of themselves with support, and not only as patients who completely depend on the system. Coming to my personal experiences and what we have learned through Meeti Zindagi's work with the diabetes community, the nurse education and training is something the governments really need to focus on. Our doctors, although already burdened with a large number of patients that they have to look after, are also taking care of many responsibilities that should ideally be performed by a well-trained nurse or paramedical staff. So yes, despite the importance, we lack nurses in general and diabetes nurses in particular. But along with that, we have another very critical issue, which is the level of diabetes-related knowledge among young resident doctors and registered nurses, which is found to be alarmingly low by various studies. There are so many incidents that I can quote here, or I would want to really share with all of you, or I know through my interaction with other members of the diabetes community. But there's one here that I would really want to share from my own life. I have had my insulin frozen in a freezer and then heated on a heater for melting so that it could be used right before my C-section by a nurse in the gynae department. It must be very, very hard to digest at this point in time, but the nurse was surely not trained for handling a person with diabetes. You can imagine how vitally important it is for the diabetes community to have access to better trained nurses for handling people with diabetes and their care. The diabetes community that we work with regularly reports the lack of training, especially in departments such as emergency for DKA or severe hypohandling and pre and post-surgery care. People have to self-connect their endocrinologists for guiding the primary care staff to provide emergency care. So again, I would say that this is exactly my role in the field of diabetes advocacy, that I have to ensure that while we recognize the critically important role of nurses in diabetes care and thank our healthcare teams for their selfless efforts and sacrifices that they make, we also recognize and talk about the gaps that need some urgent attention. The training part definitely needs to be more organized and systematic. In a nutshell, I think that there are three important areas where we need to really work hard. Number one is the better education, training, and capacity building for nurses, and better self-management education for people with diabetes so that the burden on healthcare teams can be reduced. Second, it's better communication with and about people with diabetes. We all agree that language matters. IDF has given statements about this. As of today, worldwide, the advocates are pushing for using the right language with and about people with diabetes, with teams in our, but with the teams in our country being doctor-centric. Mostly it's the doctors who are being approached for this. So it's almost throughout the world, it's a team leader who sets the culture of communication within his or her team. That's why the focus of Language Matters campaign for now is to make the doctors aware of this paradigm shift, which they need to bring into their consultations and communication. However, I think it's equally important and beneficial for the nurses and the paramedical staff to be trained in these aspects, because they, being the first contact point in many consultations, need to be very well trained about not pitying or acting surprised at a diagnosis, about not judging, about not generalizing, about making sure that the person with diabetes leads with vibes of respect, understanding, and empathy, and most important of all, positivity. Good communication can have a major impact on the psychological well-being of people with diabetes. And I would again stress this needs to be done specifically for nurses that are working in departments other than endocrine, because the endocrinologists throughout the world are hearing these things on a regular basis, and also training the nurses in their teams to take up the right communication guidelines. But the similar thing is missing from departments such as gynae, surgery, peds, etc. The third thing that is, again, a very important part and a manifestation of that is my presence here today on this panel, is that nothing about us should happen without us. I say this not only as a person representing Meethi Zindagi and Pakistan, but as a person representing the diabetes community, having worked with advocates from around the world. The diabetes community needs to be actually and thoroughly involved in shaping projects, policies, systems, and communications for us and about us. It's due time that the diabetes organizations and governments realize the importance of having people with diabetes on board who thoroughly understand the community's challenges and perspectives and can ensure that those are adequately embedded and addressed in everything about us. We need to move beyond tokenism to actual involvement. We need to ensure that there is proper involvement of community representatives for any policy, system, project, or course being designed and in the feedback process for the same. This will not only improve our experiences with the health systems, but also improve healthcare systems leadership and governance. That's all I have to say. Thank you all for doing all that you do for the diabetes community worldwide.
Thank you very much, Sana. Thank you, and thank you for your really heartfelt comments. And I really reiterate: better education, better communication, and involve diabetes community in all this. Without further ado, I would like to move to Dr. Mariam Hazreti, who is the Deputy Minister for Nursing Affairs in the Ministry of Health and Medical Education in the Islamic Republic of Iran. And Dr. Hazreti, the floor is yours to bring the policy perspectives in terms of improving the care for people living with diabetes and how nurses can involve and how what the ministries are doing to improve that involvement. Floor is yours.
Thank you. Good time, everybody, and hello to all attendants, and thanks to the organizers of this webinar, Dr. Galin, Dr. Arwa, IDF, ICN, and WHO. It is a matter of pride that in the year of nurse and midwife announced by the World Health Organization, the IDF has chosen this year's World Diabetes Day slogan, "Nurse Make a Difference," which reflects the increased attention of health policymakers around the world to the capabilities and potential of nurses in providing care to people with non-communicable disease in all areas of service delivery, including the community and clinical centers. Diabetes is one of the NCDs that accounts for a high number of premature deaths from non-communicable disease. Currently, the number of people with diabetes in Iran is nearly 5,388,000, and the prevalence of this disease in adults is 5.4%. Since non-communicable disease, especially diabetes, are associated with unhealthy lifestyle, public awareness and self-care education for patients is considered a practical solution. In this regard, considering the delegation of the responsibility of prevention and management of non-communicable disease through education by the Minister of Health to nursing deputy, the policies and plans for the prevention and management of diabetes, including these items. In the first step, a work group has been formed on the prevention and management of non-communicable disease in the Deputy of Nursing and under a national committee with the same name, and experts and in various field and disciplines have joined it to make policies for the management of this disease. Therefore, policy making has been done based on three dimensions: structure, process, and outcomes. In terms of structure, the appropriate field of service is the appropriate field of service delivery and training human resource is of great importance. Therefore, according to the prevailing culture and social conditions, outpatient care in diabetes clinics and home health care were considered. This potential has been provided through 300 diabetes clinics and 560 home health care centers. Due to the importance of education as one of the other structural dimensions of care, planning is done at the three levels of education and empowering the nursing and educating the nursing who works in diabetes and clinics wards, and also the patients and diabetes families and community members, each of which will be performed through designed mechanisms. In the dimension of process, the development of clinical care guideline for the nurses working in clinics on the agenda. On the other hand, due to the importance of providing home health care to patients with non-communicable disease, and due to the necessity of providing uniform and similar care standard package of home health care nursing service for these patients have been developed and communicated. Moreover, in order to achieve universal health coverage, efforts are being made to ensure home health care service. In the dimension of outcome factors such as patients and family satisfaction, reduction of unnecessary emergency, referrals and readmission have been considered. An operational example is the follow-up nurse, which has been designed to follow the patients with a number of non-communicable diseases, including diabetes. In this plan, patients are periodically evaluated by the follow-up nurse after discharge from the hospital, depending on their circumstance, in order to ensure their ability in self-care and adherence to treatment. In case patients have any questions or problems, they can contact the follow-up nurse and the follow-up clinics or the diabetes clinics and ask for advice. In addition, at 3 months intervals, the plan will be evaluated through evaluating the outcomes measure, including patient and family satisfaction, hemoglobin A1C, emergency referrals, or readmission. Due to COVID-19 pandemic and the vulnerability of this group of patients, some measures have been considered for patients' care, the most important of which are shifting care from the community and clinics to home health care, as well as using telenursing to provide service. Ending my talk, while thanking you for your attention, I must add that COVID-19 pandemic is not the first pandemic and will not the last either. What matters are the lessons which will be learned and the threats that will be turned opportunities. Though playing an extraordinary role in the situation, the nurses have shown in practice that the year of the nurse and midwife is not just a slogan. Thank you so much.
Thank you, Mariam. Thank you very, very much for this, and really giving a very concrete example how Iran has been taking the diabetes care as close as possible to the people living with diabetes. Now we have heard a number of examples on the role of nurses in the prevention and management of diabetes. We just would like to make a quick poll with our participants to see how do they prioritize the role of nurses in the diabetes prevention and management. Can we have the poll, please? So we would like to ask you, we have listed some of the roles which have come up during the discussions and presentations. So we would like to request you to select 3 most relevant roles for primary care nurses in diabetes care. So you can click near the options that you select. I mean, I'm just reading: early detection and strict screening, health promotion, lifestyle counseling, health education, self-care, administer oral and injectable therapies, monitoring glycemic control, including managing hyperglycemia, prevention of complications, diabetic foot. So please select 3 of them. Let's take 30 seconds to reflect. Colleagues, can we see the results? Okay, let's see what are the major roles identified by our colleagues. Okay, we can see clearly early detection screening, health promotion, lifestyle counseling, and health education and self-care have been identified as the major roles by our participants. About 70% of our participants prioritize these 3. Okay, thank you very much. And now I would like to move to discussion. We have a couple of questions, and some of the questions have already been answered by our panelists. And maybe there was a question about training. Maybe our colleagues from IDF may answer, and also what is the best test for diabetes, whether HbA1c. And third question is about the role of nurses in health education, patient empowerment. Should this be done by nurses? If this education is provided by another professional, by another cadre, what would be the role of nurses? I think this question is especially going to our colleagues from Oman and Bahrain. So maybe I'll go through the panelists quickly, and if you can provide quick answers because we are running out of time. Maybe I go to IDF first to answer some of the questions.
Can you repeat the question, please, for the IDF?
There are 2 questions. One is, what is the best test for diabetes, whether HbA1c Or the other question is capacity building of nurses is the most important to empower diabetes nurses. Is there any international training programs for nurses?
Yes, thank you very much indeed. Well, the first question quickly regarding what is the best thing for diabetes. I don't know if it is diabetes diagnosis or diabetes management, but both things. I mean, the hemoglobin A1C is important and will continue to be important, but alone, it should not be used alone. I mean, we have to use other measures like self-monitoring and other measures. That's for the hemoglobin A1C. Regarding the International Diabetes Federation nursing courses, there is a diabetes school which has been established in the IDF few years ago, and there are courses in that school, and most of them unfortunately is paid, but that for nurses is for free. I mean, there is a course for nurses in the IDF diabetes school, and there is a special course for nurses and diabetes educators, and it is available. It's a very good resource, definitely, for anybody just to revise and use it according to to his own circumstances.
Thank you very much. And also the links of those courses you mentioned and the School of Diabetes is already in our questions and answers box. Our participants can access to that. There was another question.
Yeah, if I may just add, Gulin, just to mention that the quote on the role of diabetes educators that is on the IDF school, I think on the occasion of the World Diabetes Day, the course is available free until the end of the year, so you can still register.
Okay, thank you. And another question is about whether the health education can be provided by another cadre or professional, or should the health educator be a nurse? Zubaida kindly answered that question in the chat box, but if any of our colleagues would like to add anything to this, please, floor is yours. Any of our panelists would like to add anything further to that question?
If I can add to that, health education.
Please.
Yes, thank you very much. Actually, there are places where there are no specific job for health educator or diabetes educators. Like my country, for example, we don't have a specific job called health educator. So nurses are widely used regarding that issue in different places of the world. Actually, there's an overlap between health education and nursing, and nurses should have a role in health education. Definitely, they have a role over there. So they can be used in health education, of course.
Okay, thank you. There's one last question. Maybe we can take another 30 seconds on that. What about the family role in diabetic patients?
Oh.
Maybe we can ask this question to Sana. Sana, would you like to answer? Or any of our participants?
Your voice broke out, so I did not know. So I think it's very important, as important as it is to empower people with diabetes to learn about their diabetes management. It is equally important for the families to be educated and empowered in managing day-to-day aspects of diabetes. And again, I would stress that it's not possible for doctors who are looking after, let's say, 1,000 patients to educate and empower people with diabetes and their families. And the nurses actually need to take up that role very effectively after, of course, being trained themselves for the same management part.
Thank you very much. Thank you. I would like to move to...
Can I say something, please? Can I say something, please, shortly? Yeah,
Sure.
just shortly. Regarding the health education, I just want to mention that the question whether the nurses or from other sectors or other departments, I just want to say that it depends on the type of health education. For example, regarding the food, we have a specialty, the dietitian. She's the one who can give more, even more nurses, more than nurses about the health education. So it depends on what I can say, the type of the health education itself. But for sure, the role of the nurse is a vital in health education. And regarding the family, actually, I'm a family. I'm one of, actually, I have a child with the type 1 diabetes. So I just, regardless that I'm a nurse or working in the field, in the medical field, as a relative, I found a really huge effort from the nurses in the department to give us the support, the education, regardless if I know these things or no. I'm just a mother of a child, taking care of a child with type 1 diabetes. So it's really important to give us all this information, even to deal with the child at home in case of hypo or hyperglycemia. Thank you so much.
Thank you very much. Thank you. Now, I'm conscious of the time. We had quite interesting discussions, and in preparation of the World Health Days, a lot of efforts when the celebrations were held to mark the day. But we don't want this to be a one-time effort just to celebrate this day. We see this day and designation of this day to the role of nurses as the beginning of further efforts, further emphasis on that, and turning these discussions into action. So therefore, I would like to invite my colleague, Dr. Slim Slama, Regional Advisor for Non-Communicable Diseases Prevention at the Regional Office WHO MRO, to make his suggestions how we can take it forward. Slim, it's over to you.
Thank you very much, Gulin, and welcome to everyone. It's really terrific. I was really pleased to be part of this webinar and all these experiences and insights that have been shared so far. So we would like to continue, as Gulin mentioned, that journey with you. So, and thank for Gulin, who was also behind that inspiration of, it's not enough to celebrate. We wanted to have something that would last and bring together the organization, the people living with diabetes and the communities as well on us. So I will just try at this stage to reflect on the thinking that we had behind what would be the next steps in terms of way forward. And I will invite also some comments. It's really something that is jointly carved with ICN colleagues and IDF Mena. So just try to highlight some of the points that were already addressed, I think, throughout the webinar about what is this initiative about. Next slide, Rana. So the objective, I mean, as we have phrased it so far, is really to maximize the contribution nurses and midwives are making in the region as part of a multidisciplinary team for the provision of people-centered quality services with a focus on the early detection and management of diabetes across the continuum of care. And we can revise and adapt, I mean, the objective, but this is for how we came out with this first. And there is a set of specific objectives. Next slide. One aspect is what we are doing also today, increase awareness around health professionals, policymakers, and the public on the competency and the function of nurses in preventing and managing diabetes. And you have had a range of illustrations today on the very important and meaningful contribution they're already making and how we can further enhance this. The second aspect, and you have heard of as well, I mean, improving the capacity of nurses, not only the technical capacity that we had, but also in the communication skills and how actually themselves can support people living with diabetes, not only patients, but people living with diabetes, as stressed, and also trying to scale up the training and education capacities and opportunities for nurses in the region. Next slide. So the scope is really around what David, mentioned, I think, in one of his slides about NCD in general, aspect around really empowering the nurses workforce, and so to allow them also to contribute and contribute even better to non-communicable disease prevention and improve access to people-centered services for diabetes and beyond. Really be involved in the care coordination to ensure that people's needs are met over time as part of a multidisciplinary team approach where all role and responsibility across the team are well designed and highlighted. And as we have heard, from Sana, nothing for us without us. Empowering individuals and the community for self-care and also a better engagement of people living with diabetes. And given the COVID, I think we have been also having this illustration of how much maintaining essential services has been a challenge, and maybe harnessing the technology and digital health solution is one way forward. And the nurses that we have seen, the example from Bahrain and beyond, can really have that entry point also to support their services. We have tried to highlight maybe the domain of action that this initiative will try to put forward. So next slide, Rana. These are 5 areas, and you have heard, for all the speakers that have already covered. The first one is what we are doing now is really raising the leadership role and the highlighting the contribution of nurses in diabetes care. And we started with the World Diabetes Day as an occasion, but we wanted perhaps to put a plan together, a joint communication plan, and have communication tools to be developed by each organization jointly, but also individually, to work on taking forward the activities to improve the understanding and the contribution of nurses and show the commitment to enable them, as we have seen with the example of Iran, having also the policymakers really creating that enabling environment for them to really work with the full scope of practice. The second aspect is also related to this one, and this is an example today, is creating forum and platform to share experiences across organization and good practices, and also involving communities that we have tried to do it today. So various mechanisms will be used to share experiences. This could be, meetings, webinar, publication, exchange visit, case studies. There are different ways that we can try to think to put this forward. The third element is really important because we are a very diverse region with different level of health system maturation. The NCD as part of the national agenda is not as mature in all countries we have seen with the GCC countries experiences today or Lebanon. So we need to take into account the differences by country, and we wanted also to have perhaps a better assessment of the diabetic care pathways and the health workforce involvement at different stages and requirements. So trying to identify those gaps specifically on the contribution of nurses will help us also carve an initiative that address the requirements specifically from a nursing perspective, ensuring that these enabling environment and condition are met to ensure their meaningful contribution. And the fourth point is capacity building. You have heard it. If we want the nurses to perform the required responsibilities, they need to be equipped with necessary competencies that are not only technical about diabetes care management, but also in terms of communication skills, negotiating skills, being able to work as part of a team. And this starts with reviewing perhaps undergraduate nursing education curricula, as well as aspect of continuing professional development efforts, specifically on nurses working at the primary care level. The last point, I think, that was not necessarily highlighted, but we have seen very nice example today with Lamis, I think, about the research component and how nurses themselves, in terms of operational research, can contribute to monitor the impact of the intervention that we'll be designing, but also, specifically looking at how the contribution of our nurses are making to this. I think that aspect is also a way to inform and regionalize somehow how this initiative will be developed further. So this is, the first thought and the common thought that we had as the 3 organizations. It's something that would require a formal engagement, but we wanted also to use, as we did earlier, this captive community that we have already here today with more than 120 people still here, maybe to have a second poll. But before that, I just want to invite maybe our colleague from IDF and from ICN to comment on this initiative as it is at the moment. So perhaps David and then Adel, if you want kindly to comment on the area of work and the scope of the initiative so far.
Great, thank you, Slim, for the opportunity to talk. Look, I just wanted to start by thanking the panelists that have already spoken this morning, but in particular those nurses who have spoken on their efforts in the front line. They have done themselves proud, but also their country, their region, and the world proud by what they have shared. Well done. I really enjoyed those presentations. They were absolutely awesome. And I really acknowledge the hard work that you do. So thank you for that. Just in regards to what you've shared, look, I totally agree. One of the greatest challenges that policymakers have is that there is sometimes so many problems, so many different challenges that the key message gets lost in the noise. And we need to be able to clearly identify what are those key problems that need to be addressed. And that is essential. And it's even more essential to say, well, this is how we can solve them. And if we come, together, unified, and sort of harness that voice into a more strategic, slimline voice, so that there's not so many noises demanding, it actually can be listened to and actioned because it comes with the voice of many and it comes unified. And I think that is very important when we're dealing with issues that need large-scale policy changes. In terms of sharing best practice, I mean, that is essential. Engaging with what we know. If we could do what we know already and what is the best practice, we could already make enormous differences to people's lives throughout the world. And I think that is essential to keep that channel open and to improve that understanding, not just what happens within the region, but also what's happening globally. Because there are some great lessons learned, whether they're from Tonga, whether they're from outback Australia, whether they're from within Iran. There's so many great lessons to be learned of how people are stepping up to the plate and learning and making a difference. So I totally agree. But lastly, I think it's really important to harness the opportunity that we've had this year. Despite COVID, there is a big change that has occurred. And that is the understanding of what nurses can do. The public has always been aware and trust nurses. There's a great trust in the profession. They know that we care and we provide compassion. But I think this year has really highlighted the scientific, the professional nature, and the capabilities of nurses. That conversation really needs to continue. And I see this as an important opportunity to continue that aspect of this. So they're my key points. Yes, we need to be able to do this to summarize the problems, make it clear the solutions, share the knowledge, and also harness the capability of what we have within public's trust of nurses. So thank you.
Thanks very much, David. Very well structured, understanding key challenges, how we can sell them together, sharing across border, and using this year to continue, the discussion as an opportunity to further strengthen the position of nurses. Adel, I would ask you also briefly to comment on the initiative before we go to the poll.
Thank you very much indeed. If I can have my slides, please. Well, thank you very much for giving me the opportunity to share that important session. And I'm really happy just to see this initiative coming to be real. Next slide, please. Well, I shall not repeat what has already been mentioned, but I would like to stress on the shortage of nurses in quality. And now let me tell you about the collaboration between IMRO and Mena. This is a meeting which, next slide, please. This is a meeting which had been held 7 years ago, actually, between the MENA region and the EMRO office during my term as a chair of the region. And for some logistical issues, we could not continue it. There had been an agreement on a collaboration agreement, actually, and I waited it to be continued, but now it's time for it to be continued. Next slide, please. The collaboration, we are reviving the previous attempts, and when we restarted now, we agreed to start with collaboration during the World Diabetes Day, and we agreed about a number of activities. Most of them were just a ceremonial way of collaboration, but regarding the nursing issue, it was different. Next slide, please. The nursing issue, it was different because the healthcare system has to be proactive and should never wait until people living with NCDs and diabetes deteriorate because of the NCD care disruption which happened in the COVID-19 pandemic. And because nursing is a very important pillar in the NCD healthcare, and the need of nursing is of particular importance when we have something like the COVID-19. And because the role of nursing in prevention, education, and management of NCDs in general, and diabetes in particular, should be clearly defined, and challenges to be met and gaps to be covered until nurses are fully practicing their role. Next slide, please. This is how the nurses can make the difference. It's for diabetes prevention, tackling the risk factors for type 2 diabetes, early diagnosis of diabetes to ensure prompt treatment, providing self-management training and psychological support to the patients, and particularly the use of technology. Next slide, please. Well, I shall not discuss that. Actually, it's present in the concept note, so I shall pass immediately, for the sake of time, to the way forward. Next slide, please. We in the MENA region believe that we have to start by forming a committee. That's the practical steps we have to do, actually, to implement this initiative. By forming a committee from the three organizations to plan and implement the initiative. And it will be up to this committee to study the best practices of nursing work and agreement of the standards which are needed to be achieved in the region. Next slide, please. Then data collection. I believe that we have to assess the nursing situation in the region through a group of surveys, including different stakeholders, nurses, physicians, healthy policymakers, and the public. These nurses should be designed to identify the gaps and the challenges which are needed to overcome. And we have to start by choosing a number of countries from our region, which are well representing the regional discrepancy, basically regarding the socioeconomic status of different countries, because we are not the same in our region. Next slide, please. And then we have to design the actions required to face the challenges and to cover the gaps in the form of education and training, basically. These actions will be different from one place to another. So the implementation should, next slide, please. The implementation should involve ministries of health and WHO focal points in these regions, in addition to other stakeholders in the nursing issues in the involved countries. Every country has to adapt these actions according to its own characteristics and requirements. Evaluation of the results in different communities and trying to find out the best case scenarios, stories of success and challenges met, and so on. Next slide, please. Finally, we shall have a document, I believe, which will cover the best case scenarios in different places. I strongly believe that this document will be very beneficial, not only to countries in our region, but to communities everywhere. Thank you very much.
Thank you very much, Professor. Adel said you are already, moving forward and proposing some concrete activities and action around these 5 domains that are outlined. So thank you for contributing. This is a first step on our journey, and we would like you to be involved. So given the time that is left, perhaps we will move directly now to the poll, as we did after the first panel. We would just would like to ask this community to respond and prioritize maybe the set of action that I have outlined. So Rana, if you can set up the poll, and we will start immediately. So based on the 5 areas, we ask you to select maybe and prioritize 3 out of the 5. So please, you can select up to 3. Give you a few minutes. Okay, 10 more seconds for the colleagues who haven't yet voted, and we will close the poll. Okay, Rana, perhaps you can close the poll and show the results. So as you can see on the screen, a lot of you, have prioritized first having a situation analysis, as the Professor just mentioned, identifying the gaps in strategy in order to inform the initiative, then followed by the area of capacity building, and we're discussing a competency framework. I've seen in the chat also some were discussing about health education standards courses for the region. So this could be some element as this area, then followed by sharing good practices, research evidence, and advocacy. Thank you very much. This is just a snapshot, a way to capture your views, and we will have probably the occasion to reorganize a more formal consultation on those areas. I will now give the floor back to Gulin for the last part and the concluding remarks of this webinar. Thank you very much.
Thank you very much, Slim and colleagues. I think it is great to have a way forward, and it is great that we have all commitment, all together partners to take this agenda forward on a sustainable way. We have a few more questions on the questions and answers, but unfortunately we don't have time. Sorry for that. We are running a little bit over time. Apologies, that's my mistake. And we have taken note of these questions, and we will get back to you with the responses by email, and you will hear from us. And before handing over for closing remarks to Dr. Awad Materia, Universal Health Coverage, Department of Universal Health Coverage Health Systems, I would like to thank you all, thank all the panelists for your participation, for your insights and great perspectives. And I would like to thank all the participants for your active participation and contributions, and we hope to be in touch with you all in the coming months and years. And also I would like to extend my thanks to all colleagues from WHO, EMRO, IDF, and ICN who involved in this process in organizing the webinar. And I would like to hand over to Awad for his concluding remarks and to close this webinar. Awad,
Thank you. Thank you very much, Gulen. Thank you very much, Gulen. Can you hear me?
Yes, we can hear you well. Please go
Again,
ahead.
thank you very much, Gulen, and thank you, colleagues. I mean, nowadays we talk about sort of webinar fatigue, that people are participating and assisting at many online meetings, many webinars. But this one was really an amazing one. I really enjoyed it. I enjoyed every minute of it and all the reflections and all the contributions that have been made during the webinar. I have been taking notes from all what has been said, and I would like to share with you some reflections on the discussion that has taken place and some suggestions for the way forward. First of all, when the year 2020 was announced as the year of the nurse and the midwife, this was done to recognize the important role played by nurses and midwives in promoting health, keeping the world safe, and serving the vulnerable. Of course, at that time, no one imagined that a catastrophe was on its way to impact all aspects of our lives. The COVID-19 pandemic has revealed how strategic it was to stress the importance and role of health workers at large, but also nurses in particular. So about their role, not only in normal situations, but also equally and maybe more importantly during crisis situations. As you know, colleagues, in 10 days, we will be marking another very important event, which is the UHC Day, where we will be reminding our politicians, our policymakers, of their repeated commitments that they have been making at different encounters, including at the UN General Assembly, with regard to the importance of universal health coverage. I very much appreciated the different statements that were made from the opening remarks. So what Dr. Stewart has referred to in his opening remark, when he has highlighted the need to raise the profile and the leadership role of nurses. I mean, this is really key, and this is very important to work on in order to empower nurses to serve with their full potential, to contribute to the well-being and health of everyone. Also, Dr. Hamrich, in his opening remark, he has specified what roles could be played by nurses, whether it is in regard to preventing diabetes, whether it is regard to detecting it, but also to support its management. And that is what will allow us to provide quality and respectful care to the people living with diabetes. I mean, the 5 country examples from Lebanon, Oman, Bahrain, Pakistan, and Iran have demonstrated that we can really change the status quo, and that there are innovations that could be implemented in practice if we have the right political will, if we have the right intention to change what is happening. For me, I guess what we are at a stage where we need to walk the talk. We know what works, we know what could be changed. So we just need to advocate for that. We need to hold our policymakers accountable for their promises, but also the health system managers to push them to implement the innovations that have shown their effectiveness. So if you allow me, colleagues, based on all what I have listened to and the great summary also that my colleague, Dr. Stama has given, I would like to propose 5 action points for your consideration for the discussions moving forward. I guess one of the things that we can all work on is this question of changing the service delivery model. In countries of our region, we need to change the way services are being delivered to make them more person-focused. And in countries where the main burden is due to non-communicable diseases at all, but diabetes in particular, we need to define a service delivery model that cater for the needs of this type of population. The example of telemedicine as shared by Anna from Lebanon, or the example shared by Mariam from Iran, are really things to consider in moving forward. The second action point that I'm proposing is to see how to integrate nurses within healthcare teams in their countries. I very much like what Lamis has mentioned about the integration in primary healthcare, which is key. I mean, in our work in health systems, nowadays, our main motto for our work is primary healthcare for universal health coverage and health security. What is needed is indeed to empower nurses to effectively play that role. This would require updating legislations. We need to update clinical and management protocols, but also we can leverage many tools within the health system, like changing the provider payment methods, like recognizing and compensating nurses for the work that they are doing in a fair manner. My third action point is about advocating for more investment in the production and capacity building of health workers at large, but nurses in particular. And I would like to remind you of the 2016 Commission report of the high-level Commission on Health, Employment, and Economic Growth, which highlighted the gaps and the shortages in health workforce all over the world. My fourth proposed action point is what we have worked on and what has been endorsed by our member states is the call for action for strengthening nurses in our region. And we have proposed 7 strategic directions. I mean, these need to be really pursued by everyone. We need to adapt them to the context of various disease conditions, including NCDs at large and diabetes in particular. My fifth action point, which has been also emphasized now in the poll that we have witnessed, is to document what is happening. So document the role of nurses in maintaining essential health services in the context of COVID for diabetes. And the example that Ms. Zubayda from Oman has shared with us shows that there is a lot to be shared, there is a lot to be communicated. I liked very much 2 of the statements. Again, I use them as quotes that have been given by Sana and Mariam. And if you allow me, I would like to reiterate them. So Ms. Sana Ajmal, she mentioned, nothing about us should happen without us. I think this is very, very powerful. I mean, nowadays we talk a lot about social participation more and more, and we recognize its importance in policy formulation, but also in the successful implementation of policies and strategies. Mariam said that the year of the nurse and the midwife should not be a slogan. And I guess our webinar today is a light testimony that it is not. And we can, working together, we can really make things happen. We can make the changes. So let us together make sure that the year of the nurse and the midwife goes beyond 2020. And it is great that the World Health Assembly just recently announced 2021 as the year of healthcare workers. So this is another opportunity to work together. In our work in health systems, learning from COVID, we are now calling for investment in resilient health systems. And we have identified that there are really gaps in what we qualify now as a step 0 in rebuilding health systems. We talk about the need to invest in public health, in health workforce, in surveillance system, and information system, but also in supply chain. And I guess this is, again, an opportunity. I mean, COVID is really a crisis by all means, but it also generates some opportunities for building forward better as we were qualified in our region. Let me conclude by thank you all on behalf of WHO ENRO. I would like to thank our co-organizers, IDF and ICN. I would like to thank really my colleagues from the non-communicable diseases and mental health department, Dr. Handrich, Dr. Slama, and Dr. Berri, but also my colleagues from health systems, Dr. Kula and Dr. Owais, and also our wonderful communication team who have really done a wonderful job to bring all of us together and to make this possible. So thank you very much, Nasreen and Rana, for that. Let me reiterate that our motto in the region since 2018 has been health for all by all. And we really added by all to emphasize that it is the business of all stakeholders. We need to leverage and empower everyone to maximize their contribution. And this includes all health workers of all categories. It includes the communities, it includes the patients themselves. Let me thank you all again and wish you all a good day. Thanks.
Okay. Thank you, Awad, and thank you all. I think we are closing our webinar with this good note from Awad without adding anything. Thank you. Bye.
Thank you.
Bye-bye. Thank you very much. Goodbye.
Thank you. Bye-bye.
Thank you so much. Bye-bye. Thank you so much.
Thank you.
Thank you all.
Thank you very much. Bye-bye. Nice to meet you all.
It was great.
Thank you all.
Thank you so much. My pleasure.
Thank you, Gulen. You did a great job.
Thank you for all your contributions.
Thank you. Thank you.
Thank you.
Bye-bye.
Bye-bye.
Everyone.